Our journey begins in the ancient world around 5th century BC with a malady known as the Plague of Athens. This mysterious illness, the exact nature of which still baffles historians and epidemiologists, claimed the lives of an estimated one-third of the population of Athens. The symptoms were chilling, fever, thirst, bloody throat and tongue, and a unique skin rash. Fast forward to the 14th century, the Black Death, also known as the bubonic plague, wreaked havoc across Europe, Asia, and Africa. It was a disease born from the bite of infected fleas carried by rats. At its peak, the Black Death wiped out an estimated 60% of Europe's entire population. The 16th century witnessed the Wrath of Smallpox, a deadly disease that had been around since ancient times but reached its peak during this period. It was a global pandemic, causing high fevers, severe body aches, and the characteristic skin rashes that turned into fluid-filled blisters. Smallpox claimed the lives of millions before an effective vaccine was developed in the late 18th century. In the early 20th century, the Spanish flu pandemic swept across the globe. Despite its name, the disease did not originate in Spain. It was an H1N1 virus with genes of avian origin. This deadly strain of flu infected over a third of the world's population and caused the deaths of tens of millions of people. Fast forward to the late 20th and early 21st century, and we encounter HIV/AIDS. A relative newcomer in the grand scheme of human history, HIV/AIDS has claimed the lives of more than 32 million people worldwide since the epidemic began. Most recently, the world has been grappling with COVID-19, a disease caused by the novel coronavirus, SARS-CoV-2. This highly infectious disease has shaken the world to its core, causing millions of deaths worldwide and changing the way we live our lives. In summary, from the Plague of Athens to COVID-19, we've explored the deadliest diseases that have shaped human history. Each of these diseases has left an indelible mark on humanity, affecting population growth, societal structures, and cultural practices. They've driven advancements in medical science, pushing us to develop new treatments and preventative measures. However, it's important to remember that as destructive as these diseases have been, they've also shaped us in profound ways. They've fostered resilience, innovation, and an ever-growing understanding of the world around us. Despite the havoc they've wreaked, we've always found ways to rise above them, and that's testament to the indomitable spirit of humanity.